This is Sal Rosselli, President of the National Union of Healthcare Workers. In a recent speech, Dr. Robert Pearl, the CEO of the Permanente Medical Group, which is just one of the for-profit arms of Kaiser, revealed that TPMG is thriving.
We actually had a very good financial year, $1.2 billion of margin last year.
That's in addition to the $2.7 billion in record profits last year alone, brought in by Kaiser's, quote, nonprofit wing. And Dr. Pearl says patients are very happy with quality and access.
So economically, we're doing just fine. Quality-wise, we're doing exceptional. The service scores continue to rise. Patients are very pleased with the access.
Dr. Pearl, however, doesn't mention that Kaiser was fined $4 million by California's Department of Managed Health Care for inadequate mental health care services and poor patient access to care. No, Dr. Pearl says everything is great, and Kaiser's competition is running scared.
In terms of the community around us, as I say, I think they're having significant problems. Those of you in the Oakland area, a lot of you are there, you just saw that Alta Bates is making a major cutback. And why are they doing a major cutback, laying off 300 people, including a lot of nurses? Because all their patients are joining Kaiser Permanente. That's what's going on. And so we're dominating in a variety of markets, and they're trying to figure out how they're going to respond to us.
That's a far cry from the message Kaiser presents to its employees. For months now, in mandatory meetings, Kaiser has given workers a doom and gloom message to lower their expectations regarding wages and benefits. But Kaiser paints a much different picture for shareholders. Everything is great, says Dr. Pearl. There's just one thing in the way, just one threat looming on the horizon, and it comes from Kaiser's own caregivers.
Big threat is that our nursing union has a contract coming up this year that will not get settled. There's no way it gets settled. And so we're looking at strikes, inevitably, coming up sometime in the latter part of 2014, heading into 2015.
So Kaiser's profits are up and competition is down. NUHW has a clear message for Dr. Pearl and the other executives at Kaiser Permanente. It's time to bargain in good faith with your caregivers. It's time to address the inadequate staffing issues, and it's time to recommit to the benefits package that Kaiser workers deserve and Kaiser Permanente can afford.